So we've got many years of working with members of the public on our research projects, and I'm utterly convinced that this is the right thing to be doing. I think members of the public bring additional dimensions, so they bring a lay perspective, which is really important for us as scientists to be aware of.
So PPI, or patient and public involvement, is about working alongside patient and public members to make sure that they're included in the project and that they have a voice and their voice is listened to. So within Co-Connect, this is what I see across the board. They're invited to all the meetings, they have a voice, they're encouraged to ask questions, to make comments, to give feedback, and it's really nice to see them as part of the team, real team members in Co-Connect. By doing this, it's able to show what public confidence in the project looks like. So I think whenever researchers look at or they use healthcare data, it can be quite concerning for people. Who has access to it? What are people doing with their data? And it's really important for us to have our public group here, because they can ask all the questions that the public really want to know about the data. They have an oversight to make sure that the data has been handled safely, securely, and anonymously. And it's really important for us in Co-Connect to have that.
It's really important to involve public members in a project like Co-Connect and some of the other projects that I'm on, because the projects are about our data. And it's all very well the researchers and the professors and the other academics working with the data and doing what they want to do and what's right for us in the long term in improving care around COVID, but it's still our data. And so it's really important to have public involvement in all research around healthcare, because at the end of it, it's us receiving care. And I really enjoy working in the public involvement side, because, well, a long time ago, I used to think that I couldn't do anything to change the way healthcare was. And now I can, and anyone can actually get involved in public involvement in healthcare. And it's a really good feeling. It's a really good thing to be involved in. It's really interesting, and it feels like we're making a difference.
What we try and do is engage our patient public involvement members in all aspects of our work. So from the kind of questions that we're trying to answer, to the ways in which we're trying to answer those, right through to how we disseminate the work. And
at the end of the day, we're all working for the same thing, which is to improve health for people here within the UK. And especially with COVID affects everyone. So it's really important for us to have those public members in there so that we can find out what their concerns are, what are the issues that really matter to them. And they ask the questions, the important questions, and that helps us guide our research and make sure that we're doing what the public really want us to do and need us to do in order to improve health.
So I think overall, our PPI members are essential to this endeavour. We're in the very fortunate position of having people coming from different backgrounds, different skills, genders, ethnicities, and they're working together. What they're trying to do is ensure that the work that we're doing is safe, secure, relevant, and then what we're doing is communicating that effectively back to members of the public ultimately. I think the difference here is that what we're trying to do is create a national data infrastructure to allow the safe, secure interrogation of data across the UK to try and answer pressing questions for COVID-19 that our policymakers in particular need.
One of the things that is most heartening about working with Co-Connect for the team, well, the patient and public involvement team, is how people have wanted to help because it's COVID and wanted to do something. I think through the pandemic, many people in society have wanted to do something to help, and there's been a feeling of disablement and a feeling of entrapment and not being able to do anything and not being able to help. And I think one of the great joys for me is how the members of the patient and public involvement team all feel really proud.
Within Co-Connect, I see a really strong leadership coming from Jill Beggs and also Antony Chuter, and seeing them involved from the very top in the senior management team. And they're really leading the public group as well. We work together really, really well, and I really enjoy it. I would say what's different between Co-Connect is that I see Co-Connect the public group at every meeting. They're there all the time. There's nothing that's hidden from them. Not that there is in other projects, but maybe sometimes in other projects it's maybe chosen where it might be useful for the public members to be, whereas actually the public members have chosen where they'd like to go to meetings, when they'd like to attend them. So really the power is with them in this project.
One of the things that the PPI team do tell me at Co-Connect is how they really admire the rest of the team and the work they're doing because of the complexity of Co-Connect and just how hard people are working within Co-Connect, and there's an awful lot of admiration there for the other team members. It's one of the things that makes it such a nice project to work on, such a lovely project to work on, and a project that feels like we're doing something that makes a difference and is nationally important.
Yeah, I mean, I'd just like to thank our PPI members. I mean, people are giving up their time to try and support the national effort at a time of crisis. This is challenging work. It's being done really urgently. It's a high profile, high impact, and yeah, I mean, it's not the easiest project to cut your teeth on, but I'm very, very grateful that they're working with us and being patient with us, really. And I think together, hopefully we'll be able to deliver something transformative that will enable us to take steps out of this terrible situation that we find ourselves in.
I think what I'd also like to say about patient and public involvement is sometimes it seems very serious, and it is serious. It is a very serious topic, but these are volunteers, and it's very kind of them to give up their time. So we try and make it as enjoyable as possible for them. We don't want them to feel uncomfortable when they come aboard. So we give them a pack that told them exactly about the project in lay language. We meet ourselves just as a public user group once a month, and it's a very informal meeting, and there's lots of laughs and jokes, and it's really nice to see the team come together and the jokes and the banter that we have there.